Welcome everyone and good afternoon. Thank you for joining us for today's webinar. My name is Kevin Cleary and I am a project specialist with Medistar. Medistar is a quality improvement organization dedicated to ensuring the healthiest lives possible. Our healthcare improvement and consulting services address the need for system-wide innovation and consistent evidence-based approaches across settings of care. As a nonprofit organization, Medistar receives funding from federal and state government contracts to advance our mission and healthcare transformation goals. As you may know, the Medicaid Promoting Interoperability program with Medistar offers assistance to Medicaid-enrolled healthcare providers as they meaningfully use Certified Electronic Health Record Technology, or CERT. As this program is funded by the Wisconsin Department of Health Services, services are provided at no cost to practices. Today's presentation will be focused on wrapping up Modified Stage 2, outlining the most difficult objectives and what to expect when attesting. Additionally, we will be previewing Stage 3 for program year 2019. Just a little housekeeping before we get started. Phone lines will be initially muted for the presentation and will be opened for Q&A after Modified Stage 2, as well as at the end of the presentation. If you are not asking a question, please keep your own line muted to limit background noises. If you have any questions during the presentation, please type them into the chat box in your WebEx control panel. My colleagues and I will monitor these and address them during the Q&A portions. Please be sure to send your question to everyone in the drop-down so that all participants are able to see what questions are being posted. This webinar is being recorded and will be posted to the Medistar YouTube channel within 2 weeks. Please explore the channel for past webinar recordings on a variety of meaningful use topics. Before we begin, I would like to briefly run through today's agenda. First, we will review important things about attestation, since it's likely been a while since you've done this process. Next, I will cover a few frequently asked questions we receive around some of the Modified Stage 2 meaningful use objectives. And finally, I will be giving a brief overview of what to expect for program year 2019 Stage 3 Promoting Interoperability. Let's begin with some important attestation system information from DHS. The applications for incentive payments for eligible providers who meet all 10 objectives for 2018 can be submitted through March 31st, 2019. You've probably discussed attestation with your Medistar project specialists. This is the attestation process. To be clear, though, DHS refers to your attestation as an application should you have or be asked questions. As a reminder, for 2018, eligible providers are required to use 2014 Certified EHR technology, 2015 Certified EHR technology, or a combination of the two. The standard deduction patient volume for program year 2018 is 5.33%. Additionally, all files must be in PDF, XLS, XLSX, or DOC or DOCX format. And finally, each file must be no larger than 2 megabytes in size. Finally, the EHR reporting period is any continuous 90-day reporting period in 2018. And also, please note, the CQM reporting period is now for the full 2018 calendar year. And we'll go into more detail about that later on in this presentation. Earlier this year, CMS changed the Medicaid EHR incentive program name to Promoting Interoperability to better align with other federal programs such as the Quality Payment Program and to promote the importance of EHR interoperability. As a quick reference point, here are the 10 Modified Stage 2 objectives. Those in italics will be highlighted as part of this presentation. Beginning in program year 2017, all EPs are required to submit documentation to support Objective 1, protect PHI, as well as meaningful use percentage-based measures entered in the attestation system. The table outlines the specific objectives for both modified Stage 2 and Stage 3 attestations. Again, this was required for program year 2017. I would encourage everyone to visit the Wisconsin DHS Attestation Documentation Submission Requirements website listed at the end of this presentation under Resources. The site is a good place to refresh your memory about the items discussed during today's webinar. Next, I would like to run through a few commonly asked questions we've received on a variety of objectives. First, when does the Security Risk Assessment, otherwise referred to as SRA, need to be completed? The Security Risk Analysis or review of a prior SRA needs to be completed by the end of the calendar year. If you haven't completed an SRA or review in 2018, please reach out to Metastar to see how we can help. Next question. Do all the risks identified in the SRA need to be completed by the end of the year? Answer. The SRA is essentially a gap analysis, and completing the SRA is phase 1 and is what is required for promoting interoperability. The second phase is addressing the risks identified by the SRA. Objective 2. Clinical decision support. Do I need to submit documentation around the objective when attesting? No. As we reviewed earlier, new documentation requirements to support attestation include the SRA for Objective 1 and meaningful use dashboard reports for percentage-based measures. Objective 2 doesn't require any specific document submission. However, we strongly recommend taking date-stamped screenshots of this functionality in case of a future audit. Objective 5, Health Information Exchange. If you or your provider have 100 or more referrals in a 90-day period, this objective must be met. At least 10% of those referrals need to have an electronically transmitted summary of care document. We recommend that you check with your EHR vendor on workflow specifics. Additionally, identify your top external providers and determine if they have a direct messaging address. We suggest checking out Wishin for further information or contact those providers directly. And finally, secure encrypted emails is a temporary solution to exchange the summary of care. This would require manual tracking, but is a potential option. Objective 8, Measure 2, Patient Electronic Access, as known as View, Download, Transmit, or VDT. One of the more challenging objectives practices have encountered throughout the year is Patient Electronic Access, Objective 8, Measure 2, where patients or their authorized user view, download, or transmit health information during the reporting period. The threshold is 5% of unique patients in 2018. Focus on service. Everyone in the healthcare team, from front desk staff and telephone staff to providers, has an important role in encouraging patients and caregivers to get engaged and benefit from using e-health tools. Emphasize to your patients how they will benefit. Don't ask if they would like to provide an email. Tell them if they provide an email, they can communicate more efficiently with providers, see lab results sooner, and request prescription refills. Get staff and physicians engaged. Use positive, encouraging language with both the staff and patients, and leverage every educational opportunity. Promote the portal on your website or in your waiting room. Getting buy-in is critical, and it comes from strong leadership and staff buy-in to the patient portal, which can ultimately set the stage for effective marketing and lead to higher enrollment. And finally, facilitate easy enrollment. If you're still not meeting the mark, at this stage in the year, getting staff to help likely patients to enroll within the office setting will be key. Consider developing an automatic enrollment policy where patients would have to opt out. Again, 5% seems to be a heavy lift, but really consider how many patients 5% is or equates to in 90 days. It's still possible to meet this threshold. Objective 9, secure messaging. Does the patient need to send a message for this measure to meet numerator criteria? The numerator is satisfied for this measure when a provider or delegate sends a clinically relevant message to a patient, or the other option is replying to a message that was sent by a patient through the portal. Again, this has to occur during the EHR reporting period. And note, the denominator is unique patients. The denominator is unique patients seen during the 90-day reporting period. Therefore, messages sent to those patients are only eligible for numerator compliance. More on secure messaging. Again, similar to the patient electronic access measure on view, download, or transmit, secure messaging thresholds are 5% of unique patients have to receive and or send a secure message. Similar techniques to viewing the patient portal can work for this objective. Some examples we have seen include reminder to patients to check meds and request refills in advance, sending out reminders for pre-procedure meds, and messaging around flu shots or other outstanding preventive care. Objective 10, measure option 1, immunization registry reporting. Finally, a common question around immunization registries we often receive surrounds the term active engagement. In order to meet active engagement requirements, you must register with DPH or the Department of Public Health no later than 60 days after the start of the EHR reporting period. This is critical for those of you using October 2nd through December 31st as your reporting period. If you haven't registered, you must complete that essentially by the end of this month. You are also required to respond within 30 calendar days to requests by DPH or an agent for action on 2 separate occasions. Again, this information is nicely laid out on the public health reporting sites under the Wisconsin DHS Medicaid EHR Incentive Program site that will be in the resources slide coming up. Also for 2018 is the clinical quality measures submission. Eligible providers must report on 6 clinical quality measures, or CQMs. A few important notes on CQM reporting include, for EPs, eligible providers attesting for the first time past AIU, they must provide a 90-day report for the 6 CQMs of choice. Additionally, for any EP that has previously attested to either modified stage 2 or stage 2, they must provide 6 CQMs for the full calendar year 2018. Additionally, there is no threshold for CQMs, so a provider can provide 0 out of 0 for a given CQM. At this time, we will be opening the phone lines to allow for a quick question and answer session. At this time, the phone lines are open, so feel free to state your name, your organization, and any questions you may have. Seeing and hearing none, I will feel free to answer those in the chat box, or we can certainly wrap things up at the end for any further questions or answers. As a quick reference point, here are the 8 Stage 3 objectives. Italicized means there are changes from the modified Stage 2 objectives. Ultimately, there is a change from 10 to 8 objectives between modified Stage 2 and Stage 3. However, there are more submeasures than previously in modified Stage 2. So what's changing? Ultimately, all providers who are interested in attesting for modified or for Stage 3, each of those providers must be on 2015 Certified Electronic Health Record technology. Additionally, for objectives 2, 4, and 5, as shown on the screen, we see an increase in the threshold that needs to be met for a given measure. However, the definition for each measure remains unchanged. Objective 6, secure electronic messaging, must attest to all 3 and meet thresholds for 2 of the 3 measures. So not much change in the thresholds for modified from Stage 2, but the extent to which patients are involved in their care experience is heightened. For more information, the application programming interface is a set of programming protocols established by a provider or provider education to allow patients to access their health information through a third party. The patient-generated health data is health data related data created, recorded, or gathered by or from patients to help address a health concern. PGHD includes health history, treatment history, symptoms, biometric data, and patient-recorded outcome measures. And this data is ultimately can be generated by Fitbits, Apple Watches, etc. Objective 7, health information exchange. Must attest to all 3 and meet thresholds for 2 of the 3 measures. From 2018 Modified Stage 2, there is an ever-increasing importance to health information exchange and how providers are using their EHR to connect with referring partners. Thresholds for HIE are elevated as compared to those in Modified Stage 2. Objective 8, public health reporting. This is a change from 3 to 5 measures, and italicized denotes new measures. It is important to note that just like in Modified Stage 2, there are exclusions that are applicable to providers if they are unable to meet measures. More information on what is required for this objective will be presented by Metastar in early 2019. Okay, now it's time to hear from all of you. At this time, I will unmute all lines. However, please keep your phones on mute until you have a question to pose so we can cut down on background noise. We will also review any questions that came through the chat window. Feel free to continue to send questions through the WebEx chat panel to everyone. This is a great opportunity for you to ask any questions as we have several Metastar project specialists on the line.
At the moment.
So at this time, the lines are open, so feel free to fire away any questions you may have.
Yeah, this is Chris from Metastar again. I'd be interested in, a few responses on who has 2015 cert in place, or if there's a plan, or if everybody's pretty well set with that. Can anybody comment on that?
And Chris, I would just like to piggyback off of that, asking the listeners to this webinar if they've had that conversation with their vendor regarding 2015 CERT, and if they have any insights on how those conversations went, and any lingering questions they may have for their vendors in lieu of the new regulations.
Does everybody feel like they're pretty well set for 2019 in stage 3?
This is Jocelyn. I'm also a project specialist at Medistar. We're not hearing any chatter, so I would guess either you're all set or you have no idea because you haven't thought that far. So could you give us a sense of that? That would be helpful for us to know, and we can certainly help with some of those vendor conversations to make sure that all of the T's are dashed and the T's are crossed, I's are dotted. Wow. Sorry about that.
You know, this is Tom from Marquette University. We have with our vendor, they're working on their final certification, so we expect to load that last week of December or early January.
Thanks, Tom.
Yes, thank you, Tom, and please let us know if we can help in any way, shape, or form as you begin onboarding. Any other last questions or concerns regarding modified stage 2 or looking ahead to stage 3?
I do. This is Tom. I do have a question about the stage 3 numbers that you were showing. I thought at one point that they were looking to increase the patient viewing to 10%. Has that changed from 10 back to 5?
Tom, this is Jocelyn again. There were revisions that were just approved and put in the Federal Register. I think it was early November. So I think some of those thresholds went as high as 25%, and it seems like everything went back to 5. They heard our feedback that some of those thresholds were a little bit unrealistic and preventative from further attestation.
Good. So the numbers you were showing are the latest, those November numbers.
This is Kevin, and that is correct.
Okay.
Thank you.
This is Jocelyn again. Not hearing any questions. Was there anything you had hoped that we would cover that we haven't yet, that we could either incorporate for our stage 3 or could speak to now as we're wrapping up stage 2?
If you could flip back to the Objective 7 slide, I missed the bottom thing while you were talking.
And Tom, was that for modified stage 2 or stage 3?
Stage 3.
Okay, so here is Objective 7.
Okay, thank you.
Certainly. Any other last questions or concerns?
Hey Tom, this is Chris from Medistar. Do you have a link? There's a CMS created spec sheet out there that covers those measures. Do you have access to that, or do you work with Lori? Is that correct?
Yes, Yes, and I remember seeing the early one, so I was just kind of reading through, and I didn't get to that third one before the slide change.
Okay, sure. Otherwise, we can make sure you, if you didn't have it, we can make sure you got a copy of that. So that's good. Now's your chance.
All right, as we wrap up, I wanted to provide some links to additional resources around meaningful use or promoting interoperability that are available from Wisconsin DHS, Metastar, and CMS. And you'll notice the last link there, the 2018 Stage 3 Eligible Professionals CMS spec sheets, go into a little more greater detail regarding Stage 3. Thank you everyone for attending today's webinar, 2018 Promoting Interoperability, wrapping up Modified Stage 2, looking forward to Stage 3. If you have any other questions, please feel free to reach out to me or contact your project specialist. Once you leave today's webinar, you will receive a survey on the presentation, and we would appreciate if you would complete that and provide your feedback. On behalf of Metastar, thank you for joining us today and have a great rest of your day. Thank you.